Um, First of all, I give you the introduction of influenza. That is, what is influenza? Influenza, also called flu, the flu. Yani the second name of influenza is flu. It is a contagious respiratory illness that mainly affect nose, throat, and sometimes the lungs. Caused by a virus called influenza virus, it can cause mild to severe illness and at times can lead to death. And when influenza becomes severe, it can lead to death. But usually, most of the time, it is not a severe disease. Uh, Epidemiology is that influenza is typically characterized by seasonal epidemics and sporadic pandemic. And there are two terms we are using: is epidemics and pandemics. Epidemics means the eruption or broke out the disease in some places in large quantities. And pandemic means that the disease is spread more countries in the world, more part of the world. So flu season is an annually recurring time period characterized by the prevalence of outbreak of influenza. The season occurs during the cold half of the year in each hemisphere. That is the hemisphere. You can see the world map. There is two poles in the world map, North Pole and South Pole. You can see the blue color. Blue color, usually these is called as a temperate climate region. These regions usually show influenza outbreak during November to April. And the red one, which is the another part of the temperate climate, south pole of the temperate climate, showing the influenza outbreak during the April to November. The rest of the yellow color, which is called tropical countries, the weather there in these countries are tropical. So these countries usually have life year-round influenza. There is no variation in the month. All the year, the influenza is running down in this country. You can see that half part of the Saudi Arabia coming to the yellow and half part coming to the blue one. So the upper portion showing the influenza in the November to April, and the yellow portion showing that it comes in all the year. Is actually influenza is a very common disease, but sometimes it cause, when it becomes a epidemics and pandemic, it cause increase the number of mortality. Every year influenza virus infect 5 to 15% of the world population, causing 3 to 5 million cases of severe illness, and about them 290,000 to 650,000 death every year from this respiratory cause. 5 to 10% of adult and 20 to 30% of children develop influenza every year. The reported number is thinks that it is much more higher than the recorded number. During seasonal influenza, mortality is concentrated in the very young and elderly, whereas during the pandemics, young adults are often affected at a high rate. And it means that when usual seasonal influenza like epidemics, then the mortality is more in young and elderly people. While during pandemic, most of the young adults are affected. These are the little knowledge about the major pandemics in the world. You can see that the last 120 years, there are 5 big major pandemics was occurred. Number one, first is the 1918 to 20 Spanish flu occurred, which is about 17 to 100 million people died. This is the worst pandemic in the world. And that's why the severity was 5, very high severity. After that, Asian flu, 57 to 58, 1 to 4 million people die. Hong Kong flu, 68 to 69, same 1 to 4 million people die. 09 flu pandemic occurred in 2009 and 10, and it caused 151,000 people to 575,000 people died. The most recent one is flu pandemic. The typical seasonal flu every year happening, as I told you, 290 to 650 people die every year. So you can see that this is a serious disease. Why influenza occur? Why people contracted influenza? The agent of influenza is called influenza virus. Yani the virus is the cause for the influenza. So influenza virus belongs to the family Arthomyxoviridae, which have a negative sense single-stranded RNA genome that is segmented. Yani inside the nucleus, you can see that there is only RNA genome. There are 4 kinds of influenza virus: influenza A virus, influenza B, influenza C, and influenza D virus. Influenza A and influenza B are more important than influenza C and D. Influenza A virus, first we discuss. Influenza A virus is responsible for most of the cases of severe illness, as well as seasonal epidemics and occasional pandemics. It infects people of all ages. Birds are the primary sources, but after the birds, animals and mammals can be the reservoir. Influenza A virus is classified into 2 types. Why 2 types we called? Because we can see here, as I show you here. Here you can see that there is a nuclear material, RNA nucleotide inside the nucleus, and outer side there is some spikes coming. There are 2 kinds of spikes. That's why one spike is called neuraminidase and another spike is called hemagglutinin. That's why we can say that in influenza A virus, we can classify it in 2 types: hemagglutinin H and neuraminidase, that is N. As of 2019-18, there are 11 subtypes have been identified: H1 through 18 and N1 through N11. Yani the subtype H from 1 to 18 and subtype N from 1 to 11. Most potential combination have been reported in birds flu. In birds, but 17 and 18 and 10 and 11 have only been found in bats. Only H type, H13 and N types, N1 to N2, are known to have circulated in human. These are the later, because of the pandemic and because of the epidemic, the culture of the virus gives like that. So the current influenza A virus subtype is circulating in human. Most commonly are H1N1 and H3N2. These 2 are the types of influenza A virus are more common in human being. Influenza B virus mainly infect human, but has been identified that other animals also infected. Disproportionately affecting children. This virus is more common in children. IBV contribute to seasonal epidemic alongside IVA, but have never been associated with a pandemic. Yani pandemic usually caused by influenza A virus. Influenza B virus usually cause epidemics, but not pandemic until now. Influenza C virus, it is also like influenza B virus, primarily found in humans, some animals, and infection primarily affect children and is usually asymptomatic or has mild cold-like symptoms. Yani that's why I told you in the beginning that for influenza, 2 virus is very important, influenza A and B, because C is called very mild symptoms or even sometimes asymptomatic. Influenza D virus usually cause cattle and other animal disease, not causing disease to the human. So several subtypes of influenza A which occurred in the world in the last 100 years are H1N1, H2N2, which occurred in 1957, H3N2 in 1968 as a Hong Kong flu, H5N1 2004 is called bird flu, H7N7 unusual zoonotic potential like that SADA. And these are the subgroups of influenza A virus, which is usually we can have seen in last 100 years. So this is the short history of the virus. I just give you the summary that influenza have two types of virus, four types of virus, that is called influenza A, influenza B, influenza C, and influenza D. Influenza A and B are more important because they are causing serious disease to the human being. Influenza C causing very mild disease, and influenza D usually not causing disease to the human being. And among the influenza A, influenza H1N1 and H1N3 is very important because they are recurring every time in the epidemics. Now we talk that how these virus transmit to the human being, how this virus come to the human being. So there are the transmission of virus usually have three common route of transmission, but the most important is two route, that is called droplet and airborne infection transmission. People, how it happened? For example, people who are infected can transmit influenza virus through breathing, talking, coughing, and sneezing, which spread respiratory droplet and aerosol that contain virus particle into the air. For example, if any person already infected with influenza virus, if he is a reservoir, if he has a reservoir of virus, then when he is doing coughing or like respiratory action, the virus droplet coming out from his mouth or nose, then if some people who is adjacent to this person can inhale this droplet and become sick. Then another droplet are usually affect people when they are in close contact, not more than 2 meters. And airborne infection means that the infection present in the air and it lasts more time and it is less size. So it is it can affect more than 2 meters, but usually the infection came when people come to the contact, very near to the contact. The third one is very important transmission, and this can be prevented very easily. That is contact transmission. Contact transmission means that the person maybe sneeze and some sneeze coughing and the droplet come to the surface. So when the people touching the surface and after touching the hand to the surface, use the hand to the mouth, nose or anything, these virus can be transmitted to other people. That is transmission through contact with a person, body fluid or intermediate objects can also occur, such as through contaminated hands and surface. This is the picture also. You can see that when distance is very short, less than 2 meters, then people is doing coughing or sneezing, the droplets coming outside, and anybody who is adjacent can inhale the droplet. Anybody can inhale the droplet, but some factors encourage that influenza transmission. That what are the factors? Why? That's why we are saying that influenza usually occur in the winter season, because at that time lower temperature, lower absolute relatively humidity, and less ultraviolet radiation from the sun and overcrowding. So these are the common things we are thinking that these factors encourage the influenza transmission. People who are at risk of exposure to that healthcare worker, because they are working in hospitals or in other healthcare facility, then most of the time they are seeing the patient, so the contact is higher than him, than other population. Social care worker and those who live with or care the people vulnerable to influenza. In long-term care facility like our hospital, the flu can spread rapidly. Why rapidly? Because you know that I will tell you that some high risk group, including the long-term people. Period of contagiousness. Contagiousness means that at that time, the one who is sick, for example, one person sick. So what are the time he can transmit the virus to other people? So infected person may be able to spread flu to someone else before they know they are sick, or as well as during they are sick, because for example, they do not have symptom, they think that they're not sick, but actually if they have virus, they can infect to other people. Influenza is usually transmissible from 1 day before the onset of symptoms and 5 to 7 days after the symptom starts. Yani for example, if anybody inhale the virus before 1 day he becomes sick, he can transmit the virus, and up to 5 to 7 days, the maximum period when the patient become more infectious during the 3 and 4 days of his symptoms illness began. In healthy adult, the virus is shed up to 3 to 5 days. In children and the immunocompromised, the virus may be transmissible for several weeks. Influenza virus that infect the upper respiratory tract like H1N1 tend to be more mild but more transmissible, whereas those that infect the lower respiratory tract H5N1 like tend to cause more severe illness but are less contagious. You can see in the picture that there are two: easily spread, rarely fatal, and spreads slowly, often fatal. Yani, if the virus go to the upper respiratory tract, it goes very fast, but it is rarely fatal. But if the virus go to the lower respiratory tract, it transmit very slow, but it is very fatal. So as I talked you before that some people are very vulnerable to get influenza. These people are called high risk group people. Anyone can get flu, but some people are at high risk. These include people who are 65 years and older, children are younger than 5 years, pregnant women, obesity, yani obese people, especially the BMI if greater than 35. Individual with chronic medical conditions such as chronic cardiac, pulmonary, renal, metabolic, neurodevelopment, liver or hematological disease also very high risk group people. Immunocompromised, another group, immunocompromised, any person who has a less immunity such as HIV, AIDS, receiving chemotherapy or steroid who is taking or malignancy. These people have immunosuppression. So these people also have increased chance of getting influenza virus. Now we will talk about if someone infected with influenza virus, what are the clinical features, what are the complaint of the patient coming. So when virus enter to the body, it takes 1 to 4 days, most commonly 1 to 2 days as an incubation period. And in this period during which the person not become sick. The virus is present inside the body, but person is not sick. Then after these days, sign and symptom is started. What are the sign and symptom? Many infection are asymptomatic. And most of the people who have very healthy and his immunity is very strong, so the virus not causing any sign and symptom, and he become asymptomatic. About one third of the people who infected with influenza virus. Symptoms start quietly, suddenly, initially predominant non-specific. Non-specific means general symptoms like which can be found in other diseases like common cold, nowadays coronavirus like that, COVID. And these symptoms are general symptoms. We cannot say that this is influenza symptom. These symptoms are fever, chills, headache, muscle pain or aching, a feeling of discomfort, loss of appetite, lack of energy, fatigue, and confusion. These are the general symptoms started first. These symptoms are usually accompanied by some respiratory symptom like cough, sore or dry throat, hoarse voice, and a stuffy or runny nose. Coughing is the most common symptoms associated with general symptoms. Gastrointestinal symptom may occur, but usually very rare, uncommon, including nausea, vomiting, diarrhea, and gastroenteritis, especially if occur, especially in the children. The standard influenza symptoms usually last 2 to 8 days. Yani if a person infected, 1 to 4 days incubation period, and after when the symptom starts, in 2 to 8 days, patient become cured if the complication not occur. This is the diagrammatic representation of the sign and symptom. You can see that there are many organic sign and symptoms we can see as we discussed before. Now we talk about what the complication of the flu. Then, for example, if patient becomes sick, then they have these symptoms like fever, headache, like that. If they are going to be complication, then the mortality will started. What are the complications? The most common complication is pneumonia. Pneumonia is the most common complication after influenza. Primary, there are two types of pneumonia we can say. One is called primary pneumonia or secondary pneumonia. Primary pneumonia means that is due to primary viral infection, influenza virus infection, common among those who have an underlying cardiac disease such as rheumatic heart disease, or secondary pneumonia due to secondary bacterial infection, typically has a period of improvement in symptom for 1 to 3 weeks, but can also occur after a few days. Yani, primary pneumonia usually start after the symptom continuously, but secondary pneumonia usually give a few days symptom free, a few days or week. After that, again patient become febrile, coughing, like that. About a third of primary pneumonia are followed by secondary pneumonia, most frequently caused by the cause of secondary pneumonia usually is streptococcal pneumonia or Staphylococcus aureus pneumonia. These are the two bacteria which can cause secondary pneumonia in influenza. Pneumonia present with emergency. If pneumonia, for example, if complication of pneumonia already occurred, so patient have some emergency warning sign. And if emergency warning sign appear, patient must go to the hospital to seek medical care. What are the emergency warning signs? These are the emergency warning signs. That is short, rapid progression, recurrent of high fever, shortness of breath, chest pain, dizziness, confusion, extreme vomiting, cyanosis, inability to drink fluids, sign of severe dehydration. Yani if any of these symptoms occur during or after 1 to 3 weeks of influenza virus, then you must go to seek medical support, because these are the sign of pneumonia. Other complication we can see after influenza virus are acute respiratory distress syndrome, which is very common in children after pneumonia, and meningitis, encephalitis, worsening of the pre-existing health problems such as asthma and cardiovascular disease. These are the other complications which can occur. This is a diagrammatic representation of symptoms and complication, as I discussed before. 1/3 person do not have symptoms. How we can diagnose influenza? Influenza can be diagnosed usually symptomatically and clinical. Usually during epidemics, not every time, but when epidemics occur, you know that a large number of people infected with influenza virus, at that time we can suspect influenza by clinical symptoms, as I discussed before: fever, shortness of breath, cough, nasal congestion, body pain, like that. So diagnosis based on the fairly accurate on otherwise healthy people during seasonal epidemics. Influenza, but we can also confirm the diagnosis. Influenza testing is recommended for anyone hospitalized with symptom resembling influenza during flu season or who is connected with an influenza case. For severe cases, early diagnosis improve patient outcome. Diagnostic method, various diagnostic method are used. One of the method is called rapid molecular assay. This is a very simple test, and the result will come very fast. In within hours, the result came. Other tests can take more time, and when we are going to culture the virus, it takes more time. Usually, days is required. So clinical ground, for example, when one patient coming and he says that he has shortness of breath or anything, we can do chest X-ray. This is a chest X-ray of 29-year-old person with H1N1. You can see there is bilateral consolidation, infiltration of the lungs. So when pandemic or epidemics occur, and if patient present with sign and symptom, we do X-ray, we found a bilateral infiltrate, we can say that this patient, without confirmation, that this patient may have influenza. So when we diagnose that this patient have influenza, how we treat the patient? If the patient have mild or moderate illness, not from a high risk group, and two important things. And if patient have mild or moderate illness, or if patient not belongs to high risk group, we can give symptomatic and supportive treatment. What symptomatic treatment? For example, for fever, we can give paracetamol. For cough, we can give a cough suppressant like dextromethorphan. Or if there is a sputum production, we can give expectorant. That's why if there is vomiting, we can give anti-emetic, yani symptomatic treatment. Then advice for adequate fluid intake, resting at home, and avoid alcohol and tobacco use. Antibiotic have no role unless secondary bacterial infection suspected, because this is a viral infection. So antibiotic usually cover bacterial infection. So if there is no secondary infection, no need for antibiotic. Avoid aspirin, especially in children, due to this development of Reye syndrome. Corticosteroids are not recommended except when treating with septic shock or underlying medical conditions such as chronic obstructive pulmonary disease or asthma exacerbation. Why we are not using corticosteroid in influenza? Because corticosteroids is anti-inflammatory drug. So it an anti-immunogenicity drug. So it will suppress the immune system, and the virus will not be cured, and the condition become more severe. That's why antibiotic, corticosteroid, and aspirin usually avoid. This treatment, if the symptom is moderate or patient not belongs to high. If the symptom is very severe, yani for example, patient develop pneumonia. So what we can do during pneumonia? I am in lecture system. I have lecture now. So if the disease become very severe or the patient belongs to the high risk group, then we must hospitalize the patient and give symptomatic and supportive treatment plus advice like moderate illness and antiviral treatment. We can give antiviral to these people. What are antiviral drugs? Antiviral drugs are the drugs which used to kill virus. Two classes of antivirus are used: neuraminidase inhibitor. The common drug is oseltamivir, or M2 protein inhibitor, that is called amantadine. M2 protein inhibitor are only function against influenza A virus, but nowadays no longer used because of the widespread resistance. So the only drug nowadays used is neuraminidase inhibitor, and most common is oseltamivir. Oseltamivir can be taken by orally. Zenamivir can be taken by intranasally. Antiviral are most effective when started in first 48 hours of the symptoms, after symptoms. Yani better to start in the first 48 hours when patient becomes sick. Later administration may still be beneficial for those who have underlying immune defects, those with more severe symptom, or those who have a higher risk of developing complication. Yani even the person coming in hospital after 48 hours, but if they have more severe symptom, we can give neuraminidase inhibitor. Antiviral treatment is also recommended if a person is hospitalized with suspected influenza, waiting for the test result. So the most common drug is used is neuraminidase inhibitor. Prognosis is usually good. As I told you that one-third person infected with influenza are asymptomatic. They do not have anything. So prognosis is good. Good in healthy individual, especially in healthy individuals, usually self-limiting and rarely fatal. Symptoms usually last for 2 to 8 days and complete recovery in about 1 to 2 weeks. Complication and mortality primarily occur in higher risk population and those who are hospitalized. How can we prevent influenza? There are two strategies used to prevent influenza. Number one is vaccination. Number two is the infection. The most important method to prevent influenza is vaccination. Use annual vaccination. There are two strategies. WHO recommend some high risk group people who is especially recommend vaccine. CDC recommend flu vaccine for everyone. Ministry of Health also recommend, Saudi Arabia also recommend that everyone who is more than 6 months age or older must take flu vaccine. WHO recommend vaccination for pregnant women at any stage of pregnancy, children under aged between 6 months and to 5 years, elderly individuals more than 65 years, individual with chronic medical condition, and healthcare workers. There are several kind of vaccine available and two types of vaccine. How vaccine made by two methods. Inactivated vaccine. Yani inactivated vaccine means the killed virus, the part of the virus or whole virus are used. Three types of inactivated vaccines are used, which used the part of the virus or whole virus. Whole virus, split virus or antigenic material only. Second type of vaccine, influenza, is called live attenuated influenza vaccine that contain weakened virus, but with that virus is live. So two vaccine mostly used, that is called trivalent or quadrivalent. Nowadays for 2021-2022, quadrivalent influenza vaccine is mostly used. Most flu vaccine are inactivated and administered via intramuscular injection. Live vaccine is spread into the nasal cavity, but mostly vaccine are taken by intramuscular injection. The effectiveness of flu vaccine varies significantly with an estimated average to 50 to 70%. So vaccinated people can still contract influenza because it not given 100% protection. But even not given 100% protection, even people get influenza. If get influenza, it is not severe influenza. Immunity lasts for only 3 to 6 months. That's why every year people must take influenza vaccine. Common side effect of vaccination include local site injection reaction and cold-like symptoms. Any pain in the hand maybe, or redness in the hand, or some fever, malaise, and myalgia are less common. Flu vaccines are contraindicated for people who have experienced a severe allergic reaction in response to a flu vaccine or to any component of the vaccine. Live attenuated vaccine are not given to children or adolescents with severe immunodeficiency or to those who are using salicylate treatment. Live vaccine are also not recommended for children under the age of 2 years, pregnant women, and adults with immunosuppression. Inactivated flu vaccine cannot cause influenza and are regarded as safe during pregnancy. Yani mostly the vaccine used is inactivated vaccine, and it can be used in pregnant women in all pregnancy time. Infection control are the basic measure we can take to prevent the infection. In healthcare setting, following intervention are essential to reduce transmission. Hand hygiene, the most important thing is hand hygiene, because hand are the most usual source of transmitting virus from one person to another person, or from contact surface from to the one. Use of personal protective equipment, gloves, masks, and gowns. Infected individual may be cohorted or assigned to individual room. Use negative pressure room if the patient have severe influenza. To prevent a airborne transfer while doing aerosol producing procedure. In residential home, now new admission may need to be closed until the spread of influenza is controlled. When discharging patient to care home, it is important to take care if there is a known influenza outbreak. Surface disinfectant, ammonium chloride with alcohol, rapid testing and diagnosis, and contact tracing is very important in hospital setting. In general population, we can give the education for the general population. Following measures are used to reduce the spread of infection. Health education through media and posters. Hand hygiene by frequent hand washing with soap and water or using alcohol-based hand sanitizer. Avoid touching one eyes, nose, mouth by one hand. Cover your cough and sneeze into a tissue or your elbow, then wash your hand. Avoiding spitting. Avoid mass gathering. Disinfecting surface. Staying home when sick until 1 day after symptoms. Avoiding close contact with sick people. In some cases, at outbreak, social distancing such as school closure, travel restriction, isolation, or quarantine of infected people are recommended. So just I give you the difference between cold and flu, because common cold also have same symptoms like flu, but common cold are less severe than flu. So if you see the chart here, you can see that in flu, the symptoms start very abruptly. In common cold, gradually, and slow by slow. And most of the signs and symptoms are more severe in flu than cold. So what we have to know, about seasonal influenza, that seasonal influenza are usually occurred in seasons. Most common season is the November to April season. So how we recognize the influenza? If we have fever, headache, sore throat, cough, muscle pain like symptoms, we have to take care. Then what we have to do? Use tissue or elbow while sneezing. Hand hygiene. Take rest at home. Avoid to go to gathering. Take in plenty of fluids. Good diet. And if you have severe infection, if you have any sign of emergency, must go to medical care to the hospitals. Thank you very much. If anybody want to ask any question, I am happy to answer them.
Thank you, Dr. Muhammad. That was very informative and excellent presentation. The mic is open for all. If there is any question.
I am also thankful to the education department that they provide me the time to discuss the issue, which is nowadays we are going because this is now will start inshallah October. So this is the season of influenza. So we recommend that people must take influenza vaccine before they get sick. Thank you very much for all, and especially education department.
Okay. Any question? Thank you for your doctor.
Thank you very much.